Welcome back. Healthy Health and Wellness with Dr. Ed. You know, we have an extraordinary guest in the studio right now, a voice that you will know, a voice of understanding of health by looking at the root cause. And, you know, I know we're all sick of this COVID stuff. I'm sick of the impact of all this stuff and the mistruths and deception that we've been presented. But what if you are in that area where you're susceptible, you have comorbidities, you're elderly and you're refined to a bed, and this exposure could be life-threatening, just like the regular flu can be life-threatening. Even a common cold to these people can be life-threatening. So you're in that group. What can we do? Well, we have Dr. Dennis Courtney in here with the answers for that, and he's going to be talking about something that you could look into that is being studied now by the FDA and can actually, maybe, when these studies are done, show that we can actually cure these viruses. Dr. Courtney, welcome.
Good morning, Dr. Ed. Nice to be back.
It's nice to be back. You know, we adjusted our schedule, and late last night I called Dr. Courtney and said, can you come in? It's so important for you to talk about this. And immediately he said, absolutely. So I'm thankful for that, Dr. Courtney. What is this thing that I'm referring to, these exosomes, and how has this developed?
You know, I've been coming on your air for a long time now and really promoting the regenerative medicine side of my practice. So we initially talked a lot about stem cells. That now is, that conversation is dwindling. I think the public's going to be made aware that very shortly stem cells will really be a thing of the past. What is taking the place of those stem cells, and I've had the opportunity to be utilizing these in my regenerative practice, are things called exosomes. And so we've talked about this many times before on this show, and I believe that exosomes are the appropriate replacement for stem cells when it comes to rescuing people from degenerative diseases of all type. And as such, I've been using exosomes almost exclusively now for, the joint diseases that claim our advancing population in age, arthritic conditions, of course, to other issues such as COPD, chronic renal failure, liver failure. The list goes on and on and on, and the results have been amazing. We did not know, however, that there was an amazing potential of this very product, the one I've been using now for about a year, to have the ability to cure, and it's rare for me to use the C word, tough for me to use the C word. But I think for our listeners right now, they need to know we actually found out in January that these exosomes can cure COVID-19, and the FDA evaluated that claim and moved it directly into the study phase. That little guy we call Dr. Fauci, I call him, well, no, I have other names for him.
Yeah, so do I. None that you can see on this air.
I'll refrain. How about Scarf Lady? We know her too. And we've been having them talk to us in our own homes for a long time. But they had told us, and continue, by the way, to tell us, that if you have these comorbid conditions, if you have pre-existing disease, you are very vulnerable, and you still need to shelter in place and keep your hands washed.
And social distance and wear a mask.
And wear a mask. And this is it. And these elderly folks are scared to death about getting this disease. And they did exactly what they were told. They did shelter in place. However, their grandchildren and their children who were having egress and exit from the house brought it in. We lost the largest number of people in the elderly population who were sheltered in place but had the virus delivered to them by a loved one.
By a dictate, by the powers that be, that sent them from the hospitals infected into the convalescent homes, nursing homes.
So here we are today, still telling our elderlies and our patients who are at risk to wash your hands in the state. And we now know, I know, And the public will certainly learn through the FDA studies that COVID-19 can be eradicated with the use of these exosomes. The same product I've been using now for a year. Since January, it's got an entirely different use. So, yes, I'll still use it, as I always have, as the regenerative tool for treating the arthritic knee, the hip, and the lung.
Well, when we exposed the audience first anywhere with these exosomes, when you sat at this in this studio at this desk and start talking about exosomes, that was a new word. Nobody knew anything about it.
No one had heard of it before.
And your practice is regenerative medicine. You don't, I'm not knocking medical profession. It has its purpose. These are very well-educated, bright people. The science is there. But when you look at disease processes, we basically treat the signs and the symptoms. That's a big one, okay? So even in the medical profession, it's hard to use cure. We think you have cancer and you cut the tumor away, you're cured. It's not the case. But when you can sit down and look at something that could take a process and eradicate it, that's critical. So when you brought up exosomes, and I know what you do. I've known you long enough to know exactly how you operate, and you don't look at some headline and run with it. When you see a product that's come out that's you can use in your practice, you're at the source. You go to the manufacturer, you go to the lab, you do whatever you have to do to really understand how this product is manufactured, how it's harvested, how to deliver it, what it does. Most physicians do not do that. It's hard for them to even take a call to talk to their patients, but that's what you continuously do. When you first started talking about exosomes, we talked about it for getting rid of some wrinkles in your face.
Cosmetic use.
Cosmetic use. We talked about growing of hair. Mm-hmm. And, by the way, the studio is going to open up for TV recording here sometime in July, so keep that in mind in your schedule. But we had somebody that you brought on the TV show and actually brought in the studio. Of course, the audience can't see those from the studio here. But within a 3-week period, there was a bald spot and no bald spot. So we see the effects of these exosomes, but now with the disease process, that opens up a whole new door of treatment.
Well, this all came out. Remember, we didn't know about COVID until, I think, in the United States, January.
Yeah.
That's only a few months ago. But there were studies that came out of Wuhan, China, involving women who were pregnant, were COVID-19 positive, were extremely ill. And every one of the 2 studies, small now, 9 women in one, 33 women in another, all delivered completely healthy babies. That brought the eye on the amnion world that these exosomes are harvested from. And so what is now known internationally is that this virus cannot survive in an amnion environment.
What you're saying is the developing baby is protected from this virus?
Because the baby literally floats in amniotic fluid for the 9 months of gestation before delivery. And in that environment, COVID-19 cannot survive. And that's why these women could deliver babies that were completely virus-free in moms who were very ill at the time. So our hierarchy in the company said, hey, these exosomes are harvested from the amnion. I wonder, they said, if they would have an effect on the virus. And so they sent out, and they did in vitro. Now, this was in a plate. They found out that the product killed the virus. They were amazed, but they ran to the FDA with the information. The FDA, with a jaundiced and skeptical eye, said, let us test that stuff. Let us see. Doggone if it didn't happen for them, too. Then Dr. Fauci got involved and said, that's got to be a mistake. So 4 times in now, 4 different in vitro test showed the virus was killed, and we got immediate approval by the FDA to do what Dr. Fauci says you must do. We have a study that's been going on for at least 2 months now, and it will be over soon, and the public will get the benefit of what I already know is going to be happening.
Geez, this sounds like it threatens Dr. Fauci's. Dr. Courtney, it is so important that these observations have been made by this company called Organocell. Now, they're the only ones doing this, and they're the only ones, to my understanding, according to the documents that I read, that have the okay from the FDA, which is not an easy thing to get, to proceed with this testing for this possible cure. If it's hitting the virus, this SARS-2 virus, that pretty much the mechanism of action probably impacts every virus.
Well, now that would be a jump that probably I can't leap to just yet.
I mean, but it's kind of reasonable to think that.
Yeah, so I mean, COVID-19 is called COVID-19 because it originated in 2019. Mm-hmm. What's COVID-20 going to be about? I don't know. There's going to be a COVID-20, or there's going to be a virus in 2020.
There's already 36 COVID viruses.
Okay, and so will there be the same ability to render that virus incapable of harming you as was the case with this one? I don't know. But we're still dealing with the after effects of COVID-19. So my message to the listener today is, if you are in that category of predisposed, and you're scared to death, and I know most of the elderlies are, please get treatment with this material that I have in my office, and I've had that same material now for over a year. As it turns out, it is the best preventative known. It is a prophylaxis that allows you to take charge, and instead of just sitting in that room waiting for the unmentionable, you can become bulletproof by proactively getting infused, IV infusion of that substance.
Which takes how long?
8 minutes is what it takes.
So you hook up an IV in your office.
We do an IV. We put this material after it's thawed, because it comes to us frozen, into the IV bag, and then we just drain the bag. And it takes very little time to get that in there. And from that point, we know that you're bulletproof, meaning you really are able to withstand an assault from the virus. And I've had, at this point, 10 patients that have come to me. They've heard our shows, and they took the matter into their own hands. There maybe will be more, but the call goes out to everybody who's listening. Don't think that you just have to be at the mercy of the winds. You can do something besides washing your hands and sheltering in place.
So what you're saying is, don't live in fear that's paralyzing you.
Do not live in fear. There is something you can do. FDA is not allowed to tell you what I can tell you now. They must wait for the study to be done. But we know that we've had 3 cases, Edmund, and by the way, I found out about the third last night, where compassionate use of this was used on 3 patients, elderly, who were on ventilators, who were pretty much moribund and destined to leave this good earth, and they petitioned the FDA to administer the same product in a protocol of 3 doses, 1 ml on day 1, 1 on day 4, 1 on day 8. So in all 3 cases with this compassionate use, patients got this while on a ventilator and while they were moving toward a bad place. By day 4, in all 3 cases, they were off the ventilator. Edmund, do you know how big that is? They're off the ventilator.
Oh, that's critical.
They're getting their second dose. And by the time day 8 came around, they had to wait in the hospital to get their 3rd dose because they were discharged immediately upon receiving it. This is how powerful this is. But this is 3 cases that have been used for compassionate use. The FDA is studying this on a large scale, but in these 3 cases, which I can now document, and I have the papers to back me up, this, I report now to the listener, is the proof that what I speak of actually happens.
So when you use the term compassionate cases, please define that for us.
Well, we had a couple hospitals, these were in Georgia, where elderly patients who were moribund, they were on a ventilator. The death rate is over 80%. If you get COVID-19 and you're put on a ventilator, there's an 80% mortality.
And that has to do with a lot with hypercytokine response and the damage to the tissue.
Damage to the lungs especially, right? And so because these people were moribund, the hospitals asked the FDA, could they use this substance compassionately? And there is a provision during a pandemic to allow something to be used for compassionate reasons. And it's limited. As I say, it's only been 3 cases. But in all 3 cases, elderlies who were moribund made it through and discharged, and they're now home. And so this is just a wonderful reinforcement of what I believe when these studies are finally done, because as Fauci has said, they must be double blind. They must be random. They have to be placebo. All of that is the medical mumbo jumbo for anything that ever gets through the FDA. It has to go through that process.
Except he's not saying that to get a vaccine put through. Those are being bypassed.
Right. We're going to avoid those rules when we want to.
Yeah, exactly. This is interesting in that you can do this prophylactically, meaning that you can do this as a preventative, and then you can do this as a treatment to bring about a cure of the disease.
Yeah. Now, to be honest, Edmund, I hope I never treat. I don't ever want to treat a COVID-19 patient. This needs to happen in a hospital setting because these are very ill people. I'm talking about the step that allows you to avoid ever being afflicted with the disease. That's a powerful thing.
So you call your office, make an appointment with Kim to be seen by you, and you come in for this half an hour in and out of the office, it sounds like to me.
Pretty rapid.
Yeah.
Yeah.
How long does that cover you for this virus?
That's the question I can't answer.
Okay.
Everyone asks me, well, how long is this good for? And I have no idea of how to answer them. I'm fairly certain that it's not lifelong. I can just about guarantee you that. But what is this? Is this 6 months of protection? Is this 3 months of protection? I can't answer that question right now.
So these groups that should investigate this are elderly people, are people with comorbidities, everything from heart disease to asthma,
diabetes,
and COPD.
You name it, yeah.
Okay,
yeah.
High blood pressure, part of that group as well?
That's part of the risk group, yeah.
Okay. Then people of color who have a pigmentation in their skin that prevents certain things from happening, like vitamin D3 that we know is critical. And these people of color that was one of the target groups that were getting sick.
Disproportionately ill, yes.
And then you have also obese people, supposedly with no comorbidities, but I'm going to tell you, if you're obese, it's more than just overeating. There has to be some underlying metabolic response that's not working or something. So those people should listen up and investigate this.
That's my message. Look, you don't have to be helpless. You can take charge. There is now a proven method, albeit in very small numbers, but it all started with that lab test that was done in January when we heard about the Wuhan, China studies, and it will ultimately come out the other end being an approved. FDA is going to have to reveal that everybody that was treated with this, turns out they were fixed, and the random people that got the placebo were not. It's as clear as it is the blemish on my face, that's the way this is going to turn out. The public will not be informed of this until the study is over. I, however, am allowed to tell you about what I do and my own successes and the fact that I'm aware of these compassionate uses that they've allowed people to leave the hospital and go home that were not destined to have that happen on their behalf.
So let's identify another group. I think healthcare professionals should look into this because they're in the front lines of all of this, all right? There's a good opportunity there for protection that goes beyond wearing the bubble that we're told to wear. The next group are travelers. You know, everybody's afraid to travel, afraid to get on a plane, afraid to get on a ship, a bus, you name it. Well, if you're going to travel, here's a great way to have some confidence that you're protected to go do what is normal, the way we've been doing for years and years and years that we're afraid to do now. So it's definitely worth a conversation. So will people be able to call you, Dr. Courtney?
Yeah, they should call the office and come on in to speak with me. That number out there is 724-942-3002. And the message is going out to those right now who are in fear because they know they're in that group. They know they're in the vulnerable group, and they feel there is nothing that they can do other than stay cloistered and sheltered in place.
No way to live.
There's no way to live, and to be in fear all the time would be a terrible existence. To know that there's a way to take charge of this is my message. That's the message of hope that I love to be able to provide anyway in my practice, to be able to do it in a pandemic where no one else seems to have an awareness that this can be done. Here you are in Pittsburgh. I know it can be done. I've already treated multiples, and I'm sort of got a bead with the company. I know when the next compassionate use is going to be delivered, and I'll be able to report back as the statistics grow before the FDA finally releases the real study.
And you out there have an opportunity to actually talk with Dr. Courtney today, 844-302-1250. 844-302-1250. Dr. Courtney, would you briefly explain the difference between what we term SARS-2 virus and COVID-19?
Now, COVID-19 is the name of a virus. Every year we have to name the virus of the year that we have to confront, and we're so used to having flu epidemics. But this time we got crushed with a pandemic because this was not contained in China as it could have and should have been done. But getting a flu due to a virus is one thing. But there are some tricky things that happen, and it happens with the COVID-19, is that it sets off an immunological response that leads to what is called SARS. SARS is an acronym that stands for Severe Acute Respiratory Distress Syndrome. And that is the killer. That's why this isn't the regular flu, because there's a group of people, we just got done talking about them, elderlies, comorbid states, pre-existing conditions, where, okay, yes, you have a flu, but you've tripped your immune system to literally attack your organs. And in attacking the lungs, you paint a picture what's called ARDS, Acute Respiratory Distress Syndrome, which, to put it in vernacular, literally digests your lung tissue to make paper mache out of it.
That's that hypercytokine response.
That is the hypercytokine response. Why it happens with COVID-19 when it didn't happen with a previous form of a flu, we don't know. We just know this one is, and that's the killer.
So they're identifying the signs and the symptoms with this COVID-19 term, and then the SARS is the actual virus that's causing those symptoms.
Well, but the SARS is when the immune system is heightened and acted up. So our young people, they're COVID positive. They're COVID-19 positive, but they have no SARS. They have minimal flu, sniffles, like we all have that.
Of course, nobody today is talking about influenza A or influenza B or the symptoms from that or who's dying from that, as 60 to 80,000 people a year die in this country from A and B. So I want to read something here. This is from Organocell, and this is in direct reference to what Dr. Courtney was talking about. It says, they call this Organocell flow, resulted in remarkable improvement in the clinical status, lung and renal function confirmed by follow-up chest x-rays and lab data, shows the patients no longer needed intubated, are alert, are oriented with stable vital signs and oxygenation, which is cruel because without oxygenation we're not alive. Other organs such as brain, heart, and liver commonly infected in these patients who have this SARS-CoV-2 virus have all shown progressive improvement in their function after that delivery of that 3-stage organocell exosome process. Again, just so that our audience knows, the difference between using it as a preventative, that's one treatment in and out in 20 minutes to 30 minutes.
Sure.
Quick IV hookup, as opposed to being in a hospital situation for treatment of the virus symptoms and itself. Yeah. So if that's not promising and if that's not hope, there is none.
The most hope I've ever heard mentioned and since this all began, and it happens to be utilizing the product I've used for over a year. Who would have known? Who would have thunk it?
Who would have thunk it? Because we saw the results with facially done, cosmetically
done.
Yeah,
did a great job for all that.
Yeah, and hair growth.
But who knew? Who knew it was going to be this potent a force when it comes to COVID-19? Without those studies out of China with those women, we would still not to this very day know it.
But at the same time, this organocell had to be perceptive enough to observe that. And
our
move forward.
CEO, Al Matrani, saw that, is the guy that sent that first test out.
I met him at one of your seminars.
He is the unbelievable force behind Organocell. Of course, you're so right. The moment I heard about Organocell a year ago, I was on a plane, and I was at Miami, and I was at their offices, and I've been a big fan ever since.
Well, you're doing incredible work, and that's why it's always a pleasure to have you on here. You look at the root cause of everything, not just a symptom treater. I sit here and I look at myself, and I never bought into this fear because I understand what the immune system is and how you support it, how it's the terrain, what we call terrain. That is your immune system, how you sleep, what and how you eat, how you digest, the supplements you take, the exercise, all of these things combined that make up this body terrain to fight off common infections and keep us healthy and well. So I never bought into that, but I fall into these categories myself. Half of my immune system, these organs that make my immune system, have been taken from me over the years. According to my cousin Chuck, I'm getting up in years. He wanted to point that out to me, but that's why he's buying breakfast, I guess. But there's that category. I'm a medical professional, and I'm actually back into practice.
Back in the saddle, I know.
So I'm being exposed to this, although the exposure is not that great. What other category do we have here that I'm missing? But in any case, plus I've been under house arrest for 3 months, which destroys your immune system. Been forced to wear a mask in the past to go anywhere. I'm not worried because I know this is going to pass. And it does impact some people greatly, doesn't impact others so much. My opinion, this was all handled incorrectly. You don't lock down 90% of the world for 10% of the population. You isolate the 10% that are at risk. All right? You don't destroy an economy. So I think there's an underlying message there that needs to be cured. But we have hope here. We have hope with exosomes. We have hope with Dr. Courtney, who has the ability to administer this stuff. And we have hope in the education of how to empower our bodies to be well. Would you agree, Dr. Courtney?
It's why I do what I do. And it's nice to be in that position to be able to help. Yeah.
Now, I know it's a little premature here, but you've been, of course, unable to educate people. We're doing it as much as we can on the radio. We had to stop any TV shows because that went into isolation. But your seminars were also shut down because you couldn't collect people to educate them.
Couldn't do it. Everything was locked down.
This is starting to come about to
we
open
are
up.
shooting for, and we'll have a show next month where I think we'll be right on plane again because it's coming back. I believe we're shooting to have a seminar next month where come one, come all. If you want to talk about how to rescue your joints or your lungs, that's one thing. If you would have questions about COVID, you have an opportunity to meet me, but we'll talk about that after I figure out what day of the month, in the month of July, we're going to return to the seminars that we had monthly before.
And we will let everybody know.
I'm sure
as soon
we
as
will.
you have that information. It is so important because we have hope. And we're unique in Pittsburgh to have somebody who's a medical professional give a treatment and bring this hope in our everyday lives.
Very powerful, Edward.
Yeah, absolutely, Dr. Courtney. Well, a lot of information today. That's what we're trying to do. I appreciate you listening, but I hope that you take this information and study it and investigate it and then apply it to how it makes your life better. We call that empowerment. On the show, we don't treat, we don't diagnose, but we hope to inform, hoping for you to be able to be empowered to be in charge of your own health and wellness. Dr. Courtney, please give your office number again.
Yeah, I would want to say that this entire story now, as we have had it evolve with doing your shows, is on my website. By going to my website at CourtneyMedical.com, this will now be the 7th show on this entire thing with COVID. So if you're interested in learning more, and you may have missed previous shows, they're all at one place, and you can hear them at your leisure.
And we appreciate that. I suggest everybody go and do that, and we're also going to try to get a website to have these shows on as well. God bless. Stay well, stay healthy, stay informed.